12 News. This is Arizona Nightly News.
Clearly a lot of misconduct at the VA. In the past, they've tried to sweep this stuff under the rug, and I wouldn't entirely trust these numbers. They're bad, but frankly, at the end of the day, once we're all done with this, I think they're going to be much, much worse.
Good evening. The VA, under fire for months now, today released the results of its nationwide access audit. Among the findings and promises, the agency will hold senior leaders accountable. It's removing that 14-day scheduling goal, and it will send another frontline team to address exactly what's happening here in Phoenix.
And it's going to hire new staff members for other problem VA facilities across the country. It is deploying mobile medical units, much like the ones on the ground here in Phoenix at other centers across the country. It's removing senior leadership where it has to at those facilities as well. And not only that, the VA is suspending performance awards for all VA healthcare facilities.
As evidenced by the numerous findings in the audit released today, what happened here in Phoenix has made us the absolute epicenter of reform across the VA system.
And that reform is being spearheaded by new acting VA Director Sloan Gibson. It has been an all-hands-on-deck approach to solving this mess since he took over. But as Bram Resnick found out today, there are still some very disturbing numbers connected to the problem. Bram?
That's right, Lynn Sue. We're just an hour away from another Veterans Town Hall led by the American Legion here at American Legion Post 1 near downtown Phoenix. Now, that VA audit today shows more than 100,000 veterans nationwide suffering long waits for care, and the wait times at the Prescott VA are going to get more attention. The last time the American Legion held a town hall in Phoenix, veterans gave them an earful for hours.
Now we're going to find out if the veterans have been contacted by the VA, if they're getting their appointments, and how they feel.
2 weeks later, the Legion is back, and now we know how many veterans never got their VA appointments. A new audit of hundreds of VA facilities nationwide shows 57,000 patients have been waiting more than 3 months for their very first appointment. 64,000 who enrolled in the VA system over the last 10 years have never had an appointment. Here in Arizona, the Northern Arizona VA in Prescott was flagged for further review. The average wait time for a new patient there is 2 months, and there are 1,115 patients who've waited more than 3 months for a first appointment. At the Southern Arizona VA in Tucson, the average wait time for a first appointment is 34 days. The 3-month wait list, just 132 patients. And at the Phoenix VA, where this crisis started, the wait time is 55 days, with a 3-month wait list of 1,700 patients. Democratic Congresswoman Ann Kirkpatrick asking whether a criminal investigation is needed in Prescott.
This is just confirming what we've believed for a long time.
But veterans advocate Dan Caldwell is still skeptical that the VA can investigate itself.
And I wouldn't entirely trust these numbers. They're bad, but frankly, at the end of the day, once we're all done with this, I think they're going to be much, much worse.
Now, a Prescott VA spokeswoman told me they do not know why the hospital was singled out for review, but she says the hospital is taking steps to improve care for veterans in northern Arizona. Now, this town hall here will be starting in about an hour. It is expected to be packed. Tomorrow, the American Legion moves in with a veterans crisis team based here to help vets get care at the VA. Live in downtown Phoenix at American Legion Post 1, Bram Resnick, 12 News.
All right, Bram, thanks. Senator McCain had this to say about the VA audit. Quote, this audit's findings that over 57,000 veterans are today waiting 90 days or more for their first doctor's appointment at the VA is a disgrace. As the audit states, the overreaching environment and culture which allowed this state of practice to take root must be confronted head on if the VA is to evolve to be more capable of adjusting systems, leadership, and resources to meet the needs of veterans and families.